Well, newborn calves are immediately exposed to diseases lurking in the environment, especially towards the end of the calving season. Now, fortunately, cattle producers can take various steps to optimize newborn calf health. Well, DVM of Sturgeon Veterinary Services, Dr. Scott Sturgeon, now joins us live on the phone with some tips on helping end-of-season calves build immediate immunity. Thank you very much for joining us, Dr. Sturgeon.
Hey, thank you, and good morning, Abby.
All right, so how can farmers optimize calf health during the back end of the calving season? And also, how does this differ in comparison to calves that are born at the beginning of the calving season?
Well, we always try to look at best management practices. And calves born at the beginning of calving season, they're born on clean pastures. There's not a lot of contamination from fecal shedding from other calves or from placentas being laid around or even cows that get fed on feed grounds routinely in pastures. That's where cows and calves tend to congregate, and therefore they're just going to have more contamination that will eventually start shedding into the calves.
Now, what about the environment? What environmental challenges are associated with calves that are born later on in the season?
Well, you like we just talked about, those pastures are more contaminated. When you have a pasture of 100 cows and 75 of them have calved, there's more fecal contamination out there, and those calves born later are going to have more E. coli, and there's just going to be more viral shedding just from the length of the calving season and continual contamination of the pastures.
All right, so what's your best advice as a veterinarian? What can farmers really do to ensure that calf health is not compromised and that calves actually reach their full genetic potential?
The best advice is not always practical in every situation, but the best advice is when you get down to 25% of your calving left, you move those cows that haven't calved yet to a clean pasture. Now, that's not always perfect for every scenario. And if that's the case, we sure like the first defense bolus and get that in some of those calves that are going to be born to a contaminated environment to help prevent the scours that we see in those late calving heifers or cows.
Yeah, what kind of experience have you had with successful protocols in limiting scours?
We really have two different products we choose from. We can either use an injectable vaccine, which label dose requires 2 times through the chute for injections during the 3rd trimester of pregnancy. That's not always convenient for people to try to get a large number of cows up multiple times, run them through. There's also the first defense bolus, which can be given on an individual basis, and it's a one-time treatment. Or one-time, not really a treatment, but more of a prevention.
All right, a lot of good advice indeed. We certainly appreciate all of this. Dr. Scott Sturgeon, thank you very much for your time today, and we look forward to speaking with you again in the future. Thank you.
Yes, ma'am. Thank you.